Brachial plexus. At the root of the neck, the nerves form a complicated plexus, which is called the brachial plexus. The brachial plexus is actually formed in the posterior triangle of the neck by the union of the anterior rami of the 5th, 6th, 7th, and 8th cervical and the first thoracic spinal nerves. As these nerve roots has the two rami, means the anterior and posterior rami. But in the brachial plexus, the anterior rami of these nerve roots actually unite, means combine to form the brachial plexus. Brachial plexus has the different parts, means the first comes the nerve roots, then the trunks, then divisions, then the cords, and finally after that the terminal branches that will supply the different structure. As I've already told you, the C5, C6, C7, C8 and T1 are the nerve roots, and the anterior rami of these nerve roots actually combine to form the trunks, and these trunks will actually divide into anterior and posterior divisions, and after that divisions actually combine to form the cords, and the cords finally give the terminal branches. Now we will move to the next slide so you will better understand it. As I've already told you, anterior rami of the C5 and C6 actually combine to form the upper trunk, while the anterior rami of the C7 root will continue as the middle trunk. And the anterior rami of the C8 and T1 nerve root actually combine to form the lower trunk. Now, as the trunk has been formed, trunks has been divided into the anterior and posterior divisions. So the anterior division of the upper and middle trunk actually combine to form the lateral cord, and the anterior division of the lower trunk will continue as the medial cord, while the posterior divisions of the upper, middle and lower trunk, means all of the three trunks posterior division actually combine to form the posterior cords. So you will understand that how the cords have been formed. And now the naming of the lateral, posterior and medial cord, how we will name it. Basically, these cords are in relation to the second part of the axillary artery. The part of the cord, means the lateral cord, actually lies lateral to the second part of the axillary artery. The medial cord actually lies medial to the second part of axillary artery, and the posterior cord actually lies dorsal or posterior to the second part of the axillary artery. So that's how we name these cords. As I've already told you, the C5, C6, C7, C8 and T1 nerve roots, the anterior rami actually combine to form the trunks, and the trunks has the divisions, anterior, posterior divisions, which will combine to form the lateral cord. The lateral cord actually formed from the anterior division of the anterior division of C5, means anterior division of the upper and the middle trunk, and the middle cord actually from the anterior division of the lower trunk, and the posterior cord actually formed by the posterior division of the all of the three trunks. So the lateral cord will give rise to the terminal branches. What are the terminal branches of the lateral cord? First terminal branch of the lateral cord is the musculocutaneous nerve. Other branch of the lateral cord actually comes from the another branch. One branch actually comes from the medial cord and one from the lateral cord, which actually combine to form the median nerve. So the one terminal branch of the lateral cord is musculocutaneous nerve, and the other nerve is the median nerve, which actually in combination from the branch of medial cord. So the terminal branch of the medial cord is the ulnar nerve, while the other nerves are the medial cutaneous nerve of the arm and the medial cutaneous nerve of the forearm. Now the posterior cord actually give rise to the radial nerve and the axillary nerve, while the other nerves are the lower subscapular nerve and thoracodorsal nerve. So these are the terminal branches which will comes from the cords. The other nerves, like the long thoracic nerve, actually long thoracic nerve, you have to look at the nerve roots area C5, C6 and C7. The anterior rami of these nerve roots actually, the branches of these anterior rami actually combine to form the long thoracic nerve, while the anterior rami of the C5 will give rise to, will give the branch like the dorsal scapular nerve. Other branches are the suprascapular nerve. This nerve actually comes from the upper trunk, and the nerve to subclavius actually will be come from the anterior rami of the both C5 and C6 nerve roots, the anterior rami of these two nerve roots. So you have to understand means from where the musculocutaneous nerve arises, from where the median nerve comes, from where the ulnar, radial and axillary nerve actually comes. So this is the division of the brachial plexus. The roots, as I've already told you, roots are the C5, C6, C7, C8 and T1, while the anterior rami of these nerve roots will combine to form the trunk, superior, middle and inferior trunk, or upper, middle and lower trunk, and the divisions of these trunks will actually combine to form the lateral cord, posterior cord and the medial cord. And what are the final terminal nerves? The one of the terminal branch of the lateral cord is musculocutaneous nerve, and the other is the median nerve. And the posterior cord will give rise to the axillary and radial nerve, and the medial cord will give rise to ulnar nerve and medial cutaneous nerve of the arm and medial cutaneous nerve of the forearm. So this is actually the theory parts. Theory part as the roots of the brachial plexus are the anterior rami of the C5 to C8 and most of the T1. The roots and trunk enter the posterior triangle of the neck by passing between the scalene muscle and lie superior and posterior to the subclavian artery. The three trunks of the brachial plexus originate from the roots, pass laterally over the rib bone and enter the axilla. The superior trunk, middle trunk and the inferior trunk. Superior trunk is formed by the union of the C5 and C6 roots, and the middle trunk is the continuation of the C7 root. Inferior trunk is formed by the union of the C8 and T1 roots. The inferior trunk lies on the rib bone posterior to subclavian artery. Middle and superior trunks are more superior in position. So actually these actually describe the relations of these trunks. The divisions, each of the three trunks of the brachial plexus divides into the two divisions, anterior and posterior divisions. The anterior divisions form the parts of the brachial plexus that ultimately give rise to the peripheral nerves associated with the anterior compartment of the arm and forearm. Like as I have already told you, the anterior compartment of the anterior divisions of these trunk will give rise to like the lateral cord and the medial cord. And the lateral cord will give rise to the terminal branch of the musculocutaneous nerve, and the medial cord will give rise to the ulnar nerve. And the one of the branch of the from these two, the lateral and medial cords will give rise to another nerve like the median nerve, which will supply all of these terminal branches will supply the anterior compartment of the arm and forearm. While the three posterior divisions combine to form the parts of the brachial plexus that give rise to the nerve associated with the posterior compartment, no peripheral nerve originate directly from the divisions of the brachial plexus. So this is the whole picture of the brachial plexus. As I've already explained to you, all of the means how the trunks have been formed, how the cords have been formed, and what are the terminal branches of these cords. So the three cords of the brachial plexus originate from the divisions and are related to the second part of the axillary artery. Lateral cord result from the union of the anterior division of the upper and middle trunks, and therefore has the contributions from the C5 to C7. It is positioned actually lateral to the second part of the axillary artery. Medial cord is medial to the second part of the axillary artery. It is a continuation of the anterior division of the inferior trunk. It contains the contribution from the C8 and T1. While the posterior cord occurs posterior to the second part of the axillary artery, it originates as the union of all of the three posterior divisions. It contains the contributions from all roots of the brachial plexus. So this is all about the brachial plexus. Thank you.